It's Wednesday, and that means it's time for a Health Healing and Hampton Roads. Now, today we have a very special guest, Melinda Ciccotti. She is going to be joining us for Health Healing and Hampton Roads. Welcome to Health Healing and Hampton Roads. Now, you have a career in psychology and childhood development, and you have basically been on the front lines of combating child abuse throughout your career. You're serving as the executive director of Champions for Children's Hampton Roads, and since then, Hampton Roads has been known for its progressive launching of no-hit zones, which is a major prevention of champions, a major project for Champions for Children. Now, also, that organization pretty much morphed out of an organization that's been around for a while that's called Prevent Child Abuse Hampton Roads, which we're definitely known for its Celebrity Night Out. Welcome to the show.
Oh, thank you so much. It's great to be on Hot 91.
Thank you so much. Now, tell us about the mission of Champions for Children.
Well, you've already hit upon it, Doug. It's really, our mission is to prevent child abuse and neglect, all forms, from ever happening. And that's a very, very important mission because historically, child abuse prevention has been, the system has been reactive because, of course, that's very important because after children are hurt or maltreated, then we must intervene as quickly and as efficiently as possible and repair damage. But Champions works very, very hard in working on strategies that prevent abuse and neglect from ever happening, so we don't have to try and repair damage and work with kids that have really have scars from being hurt and maltreated.
Let's talk about that thin line between parenting and child abuse so that we can frame the discussion about prevention, because one parent's corrective actions can be another parent's abuse.
Yes. And historically, and I don't know, you sound very young from your voice, but historically, adults ages 40 and over have known, that children were spanked as a corrective action, and many of those adults feel like they have grown up just fine. But what we're finding out, and it's established now in research, there's been much research on this through the past 10 years, what we're finding out is that corrective action that's physical or that is emotionally damaged is really not good for the child's physical health. It's not good for the child's psychological and emotional health. And it really is damaging the child in the future. And those problems, there's a high correlation, Doug, between abuse and severe corrective action with medical, emotional, and psychological problems. We have to be very, very careful and very progressive in how we talk about how parenting should take place in the home.
First of all, I got to just say thank you so much for that. Saying that I'm definitely young, I'm a little bit older, but I got to tell you, I grew up in a neighborhood as an African American that's pretty much inside of a cultural place where my neighborhood was the whole entire disciplinarian, where you may get in trouble at one house and you go to the other house. The parent from that house had the authority to be able to basically punish you. You get home, you get another one. The father or the uncle, that's whoever is there, is the parent figure that is there, got a chance to discipline you too. So you had multiple disciplinary actions for that one action that you actually had. And when you start to look at it culturally from the perspective of in an African American community, especially we're dealing with now cultural differences. There were no timeouts. There was going get that switch and being able, or that belt that was there, get that child, spare that rod of that child, and make sure that that child understood those boundaries, what they did wrong in that disciplinary action. And most of the time, I felt that I let my parents down. You know, most of the time I felt that I was letting them down for doing something that I didn't want to do. So I didn't want to go down that route anymore. Where, on the other hand, some of my counterparts that were not African American were in timeout. But yet, when I look at my life, I'm here on the radio. I'm here being able to be a role model, and they're behind bars. So is that is that now a cultural thing to where your studies are actually seeing a cultural difference as well?
Well, that's a very good question, and I do have a resource for that information. There is an expert in exactly that area. Her name is Stacy Patton, and I highly recommend that you look up. You can Google her, Stacy Patton Child Abuse Prevention, and find out some of the amazing work she's done and some of the very significant writings that she's done on the topic. But there are cultural differences in as you know, I mean, in all of our walks of life. But in terms of corrective action and physical punishment, just as many. I won't say that the cultural differences are that significant. It doesn't. You don't have to be of a certain race or ethnicity to be punished physically, and without and it being not done in other areas. We find it physical punishment, and that is spanking or hitting, to happen in all socioeconomic status and all ethnicities. It's just not a difference. We're trying to prevent corrective physical punishment from happening to every child.
Okay, when you're saying physical punishment, you're talking about those spankings.
I am, yes, and hitting. Hitting is spanking. That's another thing that needs to be stated. Simply, hitting is spanking. Mm-hmm. And so we really have found, research has established this, and that's why we're taking out no-hit zones so energetically. It's established that hitting is not, it doesn't have a positive outcome as the child grows up. Now, it may stop the behavior momentarily in terms of almost a fear reaction to, I've got to stop doing this or I'll be hit. But it does not bode well for the child further on in terms of emotional well-being and behavioral well-being. It does not. And we know what to do differently, Doug. We know what to do differently. We just need now to educate everyone on what will work best going forward. And that's what No-Hit Zone begins to do. It's not the whole picture. We can't get everything done at once. But mm-hmm. No-Hit Zone does a great job educating people on compassionate interactions and alternatives to any kind of physical punishment of children.
Now, what type of success is the no-hit zones actually having? And is there any evidence, that is actually backing up that psychological difference that is actually happening? Because we're starting to see now all sorts of things emerge from different type of households, basically from the mass shootings to everything that is out there. Is there a real heavy statistical information to really back up that like a no-hit zone is actually working?
Yeah, well, we certainly have the beginnings of it. No-hit zone was developed around in the early 2000 years, 2001, 2003, 2004, and it was started in pediatric hospitals, children's hospitals, because of the difficult and problematic interactions that parents with kids were exhibiting, waiting for pediatricians, waiting for medical appointments. And so it began in hospitals, and now it's emerged and come into the community, and Hampton Roads is one of the best hot spots for launching no-hit zones. And we do this very proudly. And beginning, let's see, I think we have 3 research articles now that have been published. It takes 2 years or so, Doug, to get them out. But we have a few articles that have been published, and the findings are very positive. We are seeing some differences in the behavior of adults after no-hit zone is launched, and all staff members and adults are trained in what to do other than hit.
Got it.
Yeah.
Now, April is going to be Child Abuse Prevention Month. Now, what helpful advice do you have for our listeners?
Get involved. Saturday is Wear Blue Day. I'd love to see every student, adult, kids, everyone wearing blue that day, and do everything you can to use display pinwheels. Champions for Children, you can order pinwheel bouquets.
Mm-hmm.
I'd love for you to do that, and you could either pick them up, we'll even deliver them to you. You just go on the home page of Champions for Children, HamptonRoads.org, and you can order pinwheels and display them in yards or keep them in your home. Those are things. So what they do, the pinwheels are just really provide public awareness, and it talks about what a pinwheel does. It represents the great childhoods that all children deserve and the prevention efforts that make them happen. And that's us. That's Champions for Children. And it also needs to be you, Doug. We all need to be talking about prevention during the month of April and displaying our pinwheels wherever we can.
Yes, how can people engage? Yeah, how can people engage and get involved with that?
Well, go on the website, Champions for Children, HamptonRoads.org. Go scroll down the page, and you will see free resources that you can use. You can print and use in your organizations and agencies and groups, and talk about prevention. And the fact sheets are there. And then you can also order pinwheels, plant a pinwheel garden. We have speakers that will come and speak if you'd like to have a short ceremony as you plant your pinwheel garden outside. And that can be done through Champions for Children as well.
There you go. You got a phone number if anybody can't access the web?
Oh, sure. Phone number is 757-739-6420. That comes right to my line, and I'm the one that can help you.
Thank you so much for coming on Health Healing and Hampton Roads on this Wednesday. We'll definitely reach back out to you and partner with you to get through April as Child Abuse Prevention Month.
Now, and remember this, Doug, every 81 minutes, a child is abused in the Commonwealth of Virginia.
Wow.
Every 81 minutes. This is a very serious problem, and that's why we're trying our best to get the community involved during the month of April. So please become more involved, and you can go and sign up and become a supporter of Champions, and we'd love to have you do that. And if you call the number, 757-739-6420, and I will help you personally get involved.
It's Health Healing and Hampton